And now we have the opportunity and the great pleasure of hearing Karen Aul, who was designated by this class to be their guest speaker. Karen Aul is one of our faculty, and I really expected you to bring that little person with you, Karen, that she has in class all the time. But without that, I'm sure you will be very enjoying to hear what she has to say. Karen.
Good evening. First of all, I offer my congratulations to the graduating class of 2012. You, your families, and your friends should be very proud today and very hopeful for all the possibilities of the future that are open to you. Believe in your success. You are entering a new phase of your lives at a time when the world of healthcare is changing in ways that will call upon each of you to think differently about nursing, how and what you can contribute, not only to caring about individual people, but what can you contribute to the good of your community. Nursing continues to grow and evolve. Nursing is based on society's needs and therefore exists only because of society's need for such a service. Today's demand for skilled nurses significantly outweighs the supply of such professionals. So what does this mean for future registered nurses? The United States is projected to experience a shortage of registered nurses that is expected to intensify as baby boomers age and the need for health care grows. According to the Bureau of Labor Statistics, Employment Projections 2012 to 2020, released in February of 2012, the registered nurse workforce is the top occupation in terms of job growth through 2020. It is expected that the number of employed nurses will grow from 2.74 million in 2010 to 3.45 million in 2020. An increase of 712,000 or 26%. It is expected that a shortage of registered nurses will continue to spread across the country. Within this nursing shortage, nursing is changing dramatically, as is all healthcare. In this fast-paced world, patients rely on nurses to make sense of our complex healthcare system. The nurse is the primary channel between the patient and medicine. Technology will continue to expand at an accelerating rate. There will be more precise diagnostic tests and better medicines than ever before. Advances in drug therapy will extend and improve the quality of life. The explosion of new and improved medical technology and knowledge will undoubtedly provide even more opportunities for nurses. Nurses will need to embrace these changes. Although the nursing role in healthcare are changing, the core values of being a nurse have not changed. The nurse will need to be smart, honest, respectful, non-judgmental, and dedicated to the profession. The nurse will continue to provide care, comfort, and compassion to those in need. So what does it mean to be a nurse? Being a nurse means you will step into people's lives and you will make a difference. Some people will bless you. Some people will curse you. You will see people at their very best and at their very worst. You will see life begin and end. You will be surrounded by challenges. You will carry immense responsibility. You will need to employ good clinical decision-making skills. You will have days when you question your career choice. On those days, never lose focus of why you entered the profession. Try to have enough determination to make each day better than yesterday. This is what it means to be a nurse. Believe in your success. I have believed in my success. 27 years ago, I wanted to go to college. I enrolled here at BC3 and was trying to figure out what I wanted to do with my life. I enjoyed talking to people, so I decided to go into nursing. People in my life told me I shouldn't go to college and that I couldn't be a nurse. It didn't matter to me what other people thought. I believed in myself. I believed what Eleanor Roosevelt said. You must do the thing you think you cannot do. So I believed in my success. It was tough learning the foundation of nursing. There was a lot to learn, both academically and clinically. I remember how excited I was to graduate from this nursing program and then pass my state board exam to become licensed as a registered nurse. The BC3 nursing program gave me a great nursing education. It was and still is a smart place to start. I will always remember that as I continue my college education and my doctoral program. I am thankful for entering the nursing profession. It has been very rewarding. My nursing career has taken me to many hospitals and specialties over the years. No matter where I worked, I always remembered that every patient, every person I cared for was real, was somebody's mother or father, somebody's husband or wife, someone's child, sister or brother, or someone's friend. As nurses, we touch people's lives every day, and sometimes they touch ours, and we become better nurses from that experience. I became a better nurse from those experiences. I believed in my success. A career in nursing has endless possibilities, allowing you the flexibility to choose a specialty that fits your interests and abilities. There has never been a better time to be a nurse. Not only do nurses have the opportunity to touch lives every day, they are at the forefront of an exciting healthcare revolution. So here's my advice to you, graduate nurses. Set goals. Know where you're going and what you want to do. Life is never a straight line, and that is okay. But always have a vision of what you want to be. Be educated and stay current. Keep abreast of trends in your profession. Be flexible. Be willing to change. Be open to new ideas. Ask questions and pay attention to the big picture, and pay attention to the little picture. Pay attention to those details. Resolve conflicts. Conflicts will always be present. Be prepared to overcome obstacles that come your way, but know your limitations. Know where to look for the answers. Be enthusiastic. Maintain a positive attitude and be proactive. Look at the positive in others. The happiest of people don't necessarily have the best of everything. They just make the best of everything that comes along their way. Be a good listener. Communicate well. Be sure your message is clear. Build a rapport with your patients. Be a good team player. Nurses depend on one another. And finally, you need to have passion. Do what you love to do and take your heart to work. Always do the right thing, especially when nobody is looking. Make your passion your profession. So what will determine your success as nurses? Believe in yourself. Believe in your success. As Will Rogers said, in order to succeed, you must know what you are doing, like what you are doing, and believe in what you are doing. So when opportunities knock, open the door, accept a challenge. You might surprise yourself. You have entered a career that creates a great opportunity for you. Believe in your success. Thank you.